Alrighty, here we go. Hello, everyone, and thank you for watching this pop-up webinar on Dr. Bornstein and HIPAA. Um, just going to invite our Facebook friends now. Alrighty, so here we go. Hello, everyone, and thank you for watching this program on Dr. Bornstein and HIPAA in the news. Hello, everyone out there in Facebook land. I want to invite, I want to say hello to everyone over in watching us on Facebook. We're also putting this pop-up webinar. This is a pop-up webinar. We just started doing these, and these are quick pop-up webinars. We just let everybody know about an hour in advance that we're doing these. We just put this out because this was in the news recently. These pop-up webinars go about 15 minutes, and I'm also displaying the slides that are associated with this webinar on our GoToWebinar platform. So those of you that are watching through our web platform, hello. Everyone over at Facebook Live, hello. So let's get started. Today's presentation is about Dr. Bornstein and HIPAA. Before we get started, let me tell you a little bit about myself. I'm going to be, those of you watching on Facebook Live, I'm looking at my screens, looking at my notes simultaneously, so that's why you'll see me moving around. Little bit about myself. My name is Dr. Marty Kotler. I am a chiropractor. I practiced for many years, and about 12 years ago, I started a company called Target Coding. I'm the president and CEO. I am also a certified professional compliance officer. I'm a certified billing and coding specialist. My areas of expertise include CPT, ICD-10, HCPCS coding, and Medicare and HIPAA compliance, record keeping, showing doctors how to put together compliant cash plans. And I just want to clarify, some people think I am the insurance guy. I'm not the insurance guy. I am, see, it doesn't matter to me if you're a cash practice or an insurance practice. What I'm concerned is with making sure you're maximizing reimbursement and you're complying with all billing and coding laws. We also show doctors how to implement HIPAA and Medicare compliance programs, as I mentioned. Basically, we want to make sure you're not leaving any money on the table and you're complying with all federal, state, and local compliance laws. So here we go. Dr. Bornstein. Dr. Bornstein, you may have heard about him prior to the past couple of days, but in the past couple of days, he's been in the news. Dr. Bornstein is a medical doctor in New York City. And he's an unconventional looking type of doctor, and he also has a very unconventional patient. His patient is President Trump. So Dr. Bornstein, about a year and a half ago, he disclosed information. He disclosed PHI, protected health information, private patient health information. He disclosed to the New York Times about a patient who was taking medication for hair growth. So this patient is President Trump. Dr. Bornstein stated that 2 days after he disclosed this information to the New York Times, 3 White House representatives arrived at his office unannounced and took possession of all the president's medical records. So the initial report stated that Dr. Bornstein's office was raided, and he felt that the collection of the records was done inappropriately. Well, I've read some other reports stating that the 3 White House reps followed proper protocol. What's proper protocol? That's my question to all of you. I'm going to share with you in a couple of minutes what proper protocol is. Now, Dr. Bornstein states that he normally keeps his records locked in a filing cabinet. Okay, so I'm just sharing items with you. I'm not necessarily telling you yet if anything was done inappropriate. I'm going to share my thoughts in a few minutes. So next, Dr. Bornstein stated that, now this is his quotes, "It's not a breach of medical trust." It's not a breach of medical trust to disclose that one of his patients is taking medication for hair growth. What do you think about that? Um, I don't I don't agree with him. Maybe he thinks because taking medication for hair growth is so common that it's not a big deal to talk about it. But it's like saying, hey, I have a patient that I'm treating for a sore throat. Maybe he just thought it was just such a common thing to take medication for hair growth that he thought that it's not a big deal. I can tell people that, President Trump is taking medication for hair growth. Now, Dr. Bornstein also states that he never received a signed authorization to release information. So, yeah, is that true? I don't know. Now, did the White House follow proper protocol? I don't know all the details. I'm going to be looking into this, but um, there's a lot of questions that have gotten raised based upon this situation that occurred. So, let's just go through the proper protocol. Now, some of you treat, like I have clients that treat some very high profile celebrities. I have clients that are treating very well known sports athletes. So, you want to take extra steps to keep these patients' health information private. Unless they allow you to share it. I mean, so that's up to the patient. But so just let's quickly go down the steps of what you should do if a regular patient walked in. Most of you, we have to deal with typical regular patients. Of course, if you had, a very well-known senator, a governor come into your office as a patient, yeah, you have to take, some extra steps. But they should be treated like regular patients. So here's the rundown. Proper protocol. You should see it on your screen. And there are certain forms that need to be filled out. So first thing is, you need to do a security risk assessment to find out if you have any vulnerabilities. That's step number one when it comes to HIPAA compliance. Number two, have formal staff trainings to go over what your policies and procedures are regarding HIPAA. Next, every new patient needs to sign that notice of privacy practices, that HIPAA notice. You see a sample right there on your screen. Now, members of Target Coding, you have all these forms, right? If you're a member of Target Coding, you should have these forms. If you're not a member of Target Coding, take a look at the screen. You'll see these are some of the forms you should have. So get a notice of privacy practice. Make sure it's up to date. Make sure you're using the most up-to-date one. Now, back to Dr. Bornstein. When President Trump became a patient of his, did he have President Trump read the notice of privacy practices? Did President Trump sign the notice of, you see, that notice of privacy practices has a lot of information in it that protects you, the provider. That's my first concern, is to protect you, the provider. That's what I get paid money to do, is to protect my clients and provide them with information to protect their practice, protect their business. So one of the things that you should be doing, all of you listening to this, is making sure the patients are signing an effective, up-to-date notice of privacy practice or HIPAA notice. There's a sample there on your screen. Next, if the patient needs records. So let's say the patient wants their records, and it could be for a few different reasons, right? The patient might say, you know what, I'm not happy with the care here in the office. I want to go to another doctor. I want my records. Okay. Sometimes patients say, you know what, I love coming to you, Dr. Kotler. I love the care, but I'm moving. I'm moving to another city, another state. So if the patient is leaving the practice, wants their records for whatever reason, you have to give it to them, but they need to sign a release. That's another form on the screen you'll see. You need to get an authorization to release records. You should have all these forms, very important. So the patient signs the form. The next thing you're supposed to do is enter into your PHI disclosure log where the information was being sent. who wants it and where it's going. So that's another, there's a proper protocol. There's a step-by-step checklist. So that's the next thing. Did President Trump sign the release? Did he see the notice of privacy practices when he first became a patient? I don't know yet, but these are the things that should be done. Now, let's say the patient wants to restrict their PHI, their protected health information. There's a form for that. There's a form. Let's say the patient wants to amend their records. Let's say the patient wants to request that, hey, I don't want you to call me at the office. I don't want you to call me at home. I only want you to call my cell phone. There's a form for that. Let's say the patient says, if you have to mail me anything, don't mail it to my home address. Here's the alternate address. So there's a form to where the patient wants their information to go. Now, the patient could also say, after a couple of years, hey, I heard that you are releasing my information, right? You could get requests from other providers, maybe attorneys asking for patient information. So there needs to be another form. It's called the patient request for accounting of the disclosure log, so the patient could see where you've been sending out all this information. Now, there's also employee acknowledgement forms, employee training logs, employee compliance concern forms. There are patient compliance concern forms. There are employee exit. You see it on your screen. Those are the forms. Now we sell a forms pack. Those of you that want to purchase our forms pack, we do sell a HIPAA forms pack. It's $149, so let us know if you're interested in that. Just send an email to amy@targetcoding.com. That's AMY@targetcoding.com. So just to recap, let's say you have a very well-known patient that comes into your office. Let's say, I don't know, Billy Joel, right? He's a very well-known musician. Let's say he's a patient of yours, and he says, I would like my records. First of all, when the 3 White House reps showed up, did Dr. Bornstein have to give up the records immediately? No. According to HIPAA, he has 30 days to gather the records, and as long as he gets a proper release, then he could release the information. This was a little different. This was a little unusual. 3 White House reps showed up unannounced and said, we want the records. Now, according to Dr. Bornstein, they were taken, but according to other sources, they had the proper documentation and they made copies. So if Billy Joel shows up in your office and says, I want my records, you could say, okay, Mr. Joel, we need 30 days to gather the information. Never give out the originals if you're using paper copies. So you're allowed to charge, get the form signed, document everything that has occurred. Now, you see, all this HIPAA stuff that's going on in the news right now regarding breaches like this one, and breaches for Experian and Target and Home Depot and Anthem, all of this HIPAA stuff, the more HIPAA stuff that's in the news, the more publicity that HIPAA's getting, it's going to equate to more provider scrutiny. So the more you see, HIPAA's been around for 20 years. It's only the last couple of years that it's become a big issue where the HIPAA police are knocking on doors. So if the HIPAA police come knocking on Dr. Bornstein's door, he has to say, hopefully he has the signed HIPAA notice. He has the authorization to release records signed. He has all that information. If not, he could be fined. And that happens all the time. The HIPAA police, Health and Human Services, make money. They make a lot of money fining doctors for these HIPAA breaches. So make sure you document everything. Make sure you have all the proper forms and protocols in place. Here's our HIPAA forms pack. You see it on your screen. There are the sample forms, notice of privacy practices, patient complaint form, patient request for accounting disclosures, employee concerns. So let us know if you're interested in it. We charge $149. So just a few closing comments. So I want to thank everybody for attending. Here's see on your screen, there's our contact information. You can contact me directly. My email is drkotler@targetcoding.com. There's our website, targetcoding.com. We are on all social media platforms. So follow us on Instagram and Twitter. Like us on Facebook. Check us out on YouTube. We have a YouTube channel where we're going to upload this video. If you didn't get a chance to sit through it or you want to show it to your staff members, check out our YouTube channel. Just go to targetcoding.com, click on our YouTube channel, and then you'll see all of our free videos. Alrighty, so a couple other things at Target Coding. Besides these webinars, we do seminars. Many of them are CE approved. We sell videos, we do on-site consulting, we have membership programs. We do hourly consulting if you just wanted to hire us for an hour or two. Of course, we install and implement very comprehensive HIPAA compliance programs. If you're thinking about getting a HIPAA compliance program, shop around, compare ours, find out what we do. There it is right on your screen. There's specific items of what's included in our HIPAA compliance program. Compare it to others. We do things that are different and unique than anyone else. So make sure you're comparing apples to apples. So there's our HIPAA forms pack. If you just want to buy our forms, that's fine. But that does not mean you are HIPAA compliant just by buying our forms. And we also do Medicare compliance manuals and general billing and coding policy and procedure manuals for non-Medicare practices, Medicare practices, acupuncture practices. We also have a basic membership, and we have an excellent book that we sell. It's called The Book on the Best Chiropractic ICD-10 and CPT Codes to Improve Reimbursement. You should see it on your screen. It has a whole bunch of cheat sheets. It shows you what are the best diagnosis codes. There's some more information about our forms packet. We have a physical therapy webinar coming up. We have an acupuncture webinar coming up. And your fee includes the live and the notes. So again, our contact information is 1-800-270-7044. That's our telephone. Website, targetcoding.com. And feel free to email me directly at drkotlar@targetcoding.com. That's Dr. Kotler at targetcoding.com. So I want to thank everybody for attending. I hope you learned a lot. Take care, everyone. Bye-bye.